welcome. My name is Calliope, and I will be taking care of your HENT exam today. Just a moment. Let's see what we have today. Okay, would you mind just confirming your name and date of birth for me? Excellent. And is that your preferred name? How do you like to be addressed? Wonderful. Now, is there any particular reason why you wanted to have this HENT exam? Okay. Right, I'm going to ask you a few questions and just answer them as best as you can. Are you in any current pain or have any current illness at all? Okay. And any issues with seasonal allergies, even if it's just a little bit of cropping up in the springtime or the fall? Even if it's just a little bit when you're inside for the winter, there's a lot of dust. Okay, and any problems with your voice at all? Any hoarseness, any changes? Okay, and what about your hearing? How has your hearing been lately? No changes? Okay, and any ear pain, itching, or swelling at all? Okay, and any drainage, whether it's a runny nose or perhaps draining into the back of your throat? Okay. Last couple of questions. Any medications that are not listed on your medical history? Okay. What's the dose on that? And once a day? Twice a day? Once a day. Okay. Very good. And any allergies other than seasonal allergies? Environmental, food, anything like that? Very good. Okay. So for our HENT examination, what I'm going to be doing is I will be taking a look at your head, your ears, your nose, and your throat. So we will start with the head and then move on to the ears, the nose, the throat, obviously in order. We'll also be taking a look at your sinuses. We'll be looking at your lymph nodes as well. I'll look at your thyroid. We'll look at the muscles around the sternocleidomastoid, the trapezius, right back in here. Okay? So, are there any particular areas of concern? Anything going on? Not at this time. Okay. Well, we'll take a look anyway. So, from this point onwards, I will need to be touching you. Is that okay with you? Do I have your permission to do that? Wonderful. Thank you. So, I'm just going to start by taking a little look at you. So, as we've been talking, I haven't noticed any asymmetry in the face. You haven't had any involuntary movement or tics. Your voice has been clear, there's been no hoarseness, and you've heard me just fine. But I just want to make sure that everything is reasonably symmetrical, that your features are generally midline, that your ears are about in the right position, your eyes, your nose, your mouth, what have you. Okay, Very good. So I'm going to get up and I'm going to be palpating along your head, okay? So do let me know if there's any pain or tenderness, right? So give me just a moment. There we are. Now let's take a little look. So just going to start here by looking along the hairline. Okay. Now I'm looking for things like infections or lesions, seborrheic dermatitis, psoriasis, any nits or eggs, if you were to have lice. Okay, let's just take a look right over here. Okay, and I'm just going to get behind the ear while I'm here. Look for any lesions or skin abnormalities. Okay. Right, and then we'll just take a look on the other side and pull the ear. Okay, very good. And your hair is good texture. Distribution looks good. Now I'm just going to feel the actual shape of the head, making sure that there are lumps where there should be, that there are not any bumps where there should not be. Okay, and any pain or tenderness in any of this. Okay, very good. Let me just sit down real quick. And I'll just be taking some notes. Excellent. All right. So let's take a look at your ears. First, I will be performing an external inspection, and then we will be getting our otoscope into the mix as well. So let me just start over here, I think, and we'll take a little look at the ear. So we already checked behind the ear, but I want to make sure that all these structures look healthy. There aren't any signs of lesions or swelling. Not seeing any outward signs of ear infection. And I'm just going to press on the mastoid process behind the ear. I'm going to pull up on the pinna and move the tragus as well. So just do a little press on the mastoid process. And then we'll do a little pull on the pinna. And then we'll do a little push on the tragus. Okay. Any pain in any of that? No? Switch to the other side then. So let's take a little peek at the ear. Okay. And color looks good. Tissues look healthy. Okay, so let me just go ahead and press on that mastoid process, pull on the pinna, and press on the tragus. So you'll just feel my fingers behind the ear as I press on the mastoid process. Okay, let's go ahead and pull. Okay, and on the tragus, let's press. Okay, And any pain or tenderness in any of that? No. Okay. Very good. So we're going to take a real quick detour, and we're going to look at your jaw and the muscles around your jaw. Okay, we have the temporalis muscle, we have the masseter muscle, and we have the temporomandibular joint right in here. Do you have any problems with opening or closing your jaw? Any jaw pain? Any popping at all? No. Okay. So I am just going to palpate the joint first, okay? Do let me know if there is any pain in this. Okay, good. And if you could just open your mouth for me. Close. Open. Close. Okay. Any pain at all? No? Okay, and if you could clench your jaw. Good. Unclench. Clench. Unclench. Good. I'm going to feel the temporalis muscle here. So if you could open your jaw. Close it. Open. Close. Good. If you could clench your jaw. Unclench. Clench. And unclench. Very good. Okay. So let me see. I think that we will bring out the otoscope here. So with this, I am going to grab a speculum, brand new speculum, and just snap that on. And we're going to be taking a look inside your ear, okay? Do let me know if there's any pain or tenderness, and I want you to try to remain still, but I will be stabilizing myself so that if you do happen to move, it will not poke you, okay? All right, so I think, let's start over here. All right, give me just a moment. Okay, so we start by pulling up and back on the pinna to straighten out the ear canal. Good, and then there. All right. So I'm looking at the ear canal, and we're looking at the tympanic membrane. Now the tympanic membrane should be a pearly gray color. There should not be any perforation, shouldn't be any bulging, shouldn't be any discharge, no swelling, redness. I'm just making sure that everything looks okay from that end. Right, I'm just going to adjust a little bit. There we go. Very good. Okay. So I'm just going to pull this out real quick. And then we are going to do just a quick little thing. So I want to see how your tympanic membrane moves. Now, sometimes there are otoscopes that have little attachments that I can have a little ball on. I can just puff a couple little puffs of air on your membrane, see how it responds to that. This particular otoscope does not have that capability. So what I will have you do is I will let you know when to do this, but I'll have you close your nose, okay, and blow very gently. And that should make that little membrane move just a little bit. Now you have to remember to blow very gently, okay? All right, can you just do that real quick for me? Yeah, just like that. Okay. So I'm going to put this back into your ear and we'll do that real quick. All right, so we'll pull up on the pinna go back. There we go. Okay, so I've got a good seal here. You could just very gently blow while your nose is held shut. There, just a little bit. You can stop. Okay, now I'll take this out. And then we'll do that same routine on the other ear. I'll take a look inside the ear. We'll do the little tympanic membrane test, and then we'll take it out. So we will pull up and back and insert the otoscope into the ear canal. Okay. Right in position. For signs of cerumen blockage, looking for signs of infection, looking for swelling, redness, irritation, anything that could be going on with the ear. Okay. Right, that looks good. Tympanic membrane looks healthy. So can you do that little exercise for me now? Where you hold your nose shut and blow very gently. Very, very gently. Good, good. Okay, you can go ahead and stop. And I will just pull up and back and pull the otoscope out. Okay. Just like that. Let's take off that speculum. Alright, so now we're going to do a few different hearing tests. Even though you've been able to hear me this whole time, you've responded to me, I just want to make sure. So we'll do a few different tests. Firstly, we're going to do a little finger rustling or finger rubbing test. I'm going to have you close your eyes for me so you don't see any of my movement. And I'm going to rub my fingers together in one ear, the other, or both. Okay? Just want you to tell me whether you hear it on the left side or the right side. Okay? All right. Close your eyes for me. Good. And if you could just tell me whether you hear it on the left or the right. Okay? Good. 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 Excellent. Now this time we're going to do a little whisper test. So you're more than welcome to open your eyes. And I'm going to be whispering something in one ear or the other. And I just want you to tell me what you hear. Okay? All right, so in the continued fashion that we have been, I'll start with this ear. Blue. Ball. Towel. Clip. Jar. Okay, what were those words? Good. We'll do it on the other side. Light. Face. Point. Purple. Wood. And what were those words? Excellent. Very good. Now for the last one. We are going to get out the 512 hertz tuning fork. This little guy. And we are going to be doing the Weber and Rinne test. Now for the Weber test, I'm actually going to use a little tuning fork striker here. And I am going to be putting it right in the center of your forehead. And I just want you to tell me whether you hear the sound more on the left side or on the right side, okay? That's the Weber test. Then for the Rinne test, I'm going to strike the tuning fork, and I'm going to put this right on the mastoid process, like I felt before. And I'm going to ask you when you stop hearing the sound. Then when you stop hearing the sound, I'll bring it right in front of the ear, and then you tell me when you stop hearing it then. Okay? Pretty simple. Let's start with the Weber. Side do you hear it on? Okay. Side do you hear it on? Good. Let's go ahead and do the Rinne test. Just let me know when you hear the sound. Then when I move it, let me know when you hear it again. Okay. Hear that? When's it stop? Good. Hear that? When's it stop? Hear that? When's it stop? Good. Hear that? When's it stop? Good. Hear that? Stop. Hear that? Good. Good. Okay. In just a moment. You've been doing absolutely lovely. I appreciate it. Okay. Let's take a little look at the nose. I'm going to pull my sleeves up a little bit more. All right. So I just want to visually inspect your nose here. If you had any problems with your sense of smell, any problems with any pain, I know we talked about drainage a bit, but any stuffiness. Okay, and what about your sinuses? How have those been? Yeah, I'm not seeing any swelling. I'm going to just press on the bones in here, okay? I'm going to press these. And I'm also going to tap along them, do a little bit of direct percussion. You just let me know if you feel any pain or tenderness, okay? So I'm just going to press in on your cheekbones here. Press, press. Any pain? No? Okay, and right under the eyebrows. Okay, how is this? All good? All right. I'm going to do a little bit of direct percussion. Okay. So just going to tap, 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 tap along the cheekbones, maxillary, along the nose. We have the ethmoid. And then we have the frontal sinuses. Okay, and how was all that? Just fine? Okay, I'm just going to palpate the nose a little bit, around the nares, and along the nose and the cartilage. Okay, any pain? No? All right. So now I'm just going to have you lift your head up a little bit, and I'm just going to push the ball of your nose up. I'm going to take a look at your septum and inside your nose, and then we'll be grabbing the otoscope and taking a look deep into the nose. All right? Okay, so if you could tilt your head up, I'm just going to very gently pull up on the nose. We'll look at the septum, look for any deviation. look for any immediate issues right in the beginning of the nose, okay? And if you could just keep your head there, let me grab a new speculum. Okay. And I'm going to look up inside the nose, so the speculum will go just a little bit into the nose, okay? I want to look at the turbinates. I want to look deeper at the septum and the mucosa. And just hold still for me. Okay. Very good color. Not seeing any swelling. Right. No perforation. Okay. And we'll just go to the other side here real quick. There we are. Very good. Alright, that looks good. Okay. Let's go ahead and toss that speculum, and you can bring your head back down. Give me just a moment. You've had no problem with breathing at all, right? Yeah, I didn't think so, but actually now that I'm thinking of it, let's go ahead. I'll just have you cover one side of your nose and breathe a couple times with one side and the other, okay? So I'll just go ahead and cover one side. If you could just breathe for me. Very good, okay? And then the other side. I haven't noticed any abnormal breathing or any sounds, whistling, nothing like that while you've been here. Okay, very good. Just want to make sure. And then we'll be moving on to your lips and your mouth and your throat. Okay? So let me go ahead. I'll need my otoscope, and we'll need a tongue depressor as well. Okay, so let me take a look at the lips. And I just want to make sure they are the correct color. They're not too pale. That there aren't any skin abnormalities. There's no swelling. Okay, and if you could just open your mouth a little, I want to check the corners of your mouth. Good. Good, okay. If you could just open your mouth all the way and stick out your tongue for me. Okay, very good. Tongue looks good. I'm just going to use the tongue depressor, and I'm going to just go into the sides of your mouth and look at the buccal mucosa. We'll just go in here and take a look. Right. Very good. Okay. And then let's take a look at the teeth. So I'm going to look at the upper teeth, looking for any signs of dental problems. If you had any pain, sensitivity, any problems with your teeth? No? Let's take a look at the bottom ones. Good. Now real quick, I'm going to check for dental occlusion. So I'm going to have you keep your mouth open, and then I'll put this on one side of your teeth. I'm going to have you bite down, okay? Right here, and bite down. Just going to pull that a little. Okay, if you could open your mouth. Yep, and then just bite down on this one. Good. I'm just going to pull a little. Okay, and open your mouth. Now I'm just going to tap, 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 tap on your teeth with the side of our tongue depressor. Okay. Any pain? No? No pain? Okay, very good. So let's take a look underneath the tongue real quick. If you could lift your tongue to the roof of your mouth. Good. Right. Let's see, I just want to look. You have Wharton's ducts underneath the tongue. I want to look at. And in the pocket of the cheek, you have the Stenson's ducts. These are from your different salivary glands. Okay, that all looks good. Do you mind sticking out your tongue for me? Okay, and can you move it to the left and the right? Up and down. Very good. You can stick it back into your mouth. In just a moment. Okay, we have a couple of things left here. So if you could just lift your upper lip up, I could take a look at the gums. Grab my light. Good. Okay, and if you could just pull down your lower lip. Very good, very good. All right. And I'm just going to have you stick out your tongue a little bit. I'm going to look at the hard and soft palates. I'm going to grab my tongue depressor real quick too. Okay, and then I'm just going to depress the tongue while I look at your throat. Okay, just like that. Would you mind saying ah for me? Good. The uvula is midline. I don't see the tonsils. Throat looks good. There's not any irritation. No redness. Just pink. Pink. Okay, very good. So let me go ahead and take that out and we'll toss that. I'm going to feel around. I'm going to feel for your parotid gland. You also have a sublingual and a submandibular gland in this area. Now, if I really wanted to get in there, I would also have to put my fingers into your mouth and press down, but we're not going to do that today. So let me feel the parotid gland here. Okay. I'm just going to feel underneath the jaw. We could also feel the buccal mucosa, but we're not going to do that today. You could also grab your tongue with a little bit of tissue or gauze if I were to suspect any lesions or cancer, ulcerations, things of that sort. Okay, I'm going to feel your sternocleidomastoid and I'm going to feel your trapezius muscles as well. Okay, these are in your neck. Have you had any problems with pain in the neck? Okay, does anything feel real tight or do you feel any swelling in the neck? No. And how's range of movement? We'll check that in a moment. Okay, and the trapezius muscle right on the back, this big triangular shaped muscle. It's the one that usually gets all knotted up. Okay, good. Now, we're going to check range of movement real quick while we're talking about the neck, and then we'll look at the lymph nodes. Okay, so could you please turn your head all the way to one side? Good, and the other? All right, and can you go all the way down? Or as far as you can. Good, and go all the way back. Very good, and can you tilt your head? Just like that. Try to bring your ear to your shoulder. Get a nice stretch in here. Yes, very good. Okay, and no pain or restriction in any of that? No? All right. So let's go ahead and feel the lymph nodes, and then we'll look at the throat, the outer throat. We'll look at the thyroid, okay? So let's start with feeling the occipital nodes at the back of the head. These are generally about on your hairline, most people. Okay, and then we're going to bring it to behind the ears. These are the post-auricular nodes. Okay, and then we bring it in front of the ears. These are the pre-auricular nodes. And we've already felt the parotid gland, so we're going to go into the tonsillar nodes. Okay, and the submental and submandibular. Go underneath the jaw. In here. Okay, and then we're going to feel for the superficial and deep cervical nodes. We'll also feel for the posterior cervical nodes, all in the neck. Good. Very good. And then finally, supraclavicular, right above the clavicle. Very good. I'm not feeling any distension in any of these. Just good. Okay, let's have a look at the throat. So, as we've been looking, I haven't felt any swelling. I haven't felt any masses. The trachea is midline. You haven't had any problems swallowing, right? No, and I haven't seen that either. Okay, I'm just going to very gently feel around here, okay? Might be just a little uncomfortable. Okay, very good. All right, so now I'm going to take a look at your thyroid, okay? So you have your cartilage, and then we get to a soft spot down on the lower part of your throat. And I'm going to stand behind you, and I'm going to feel around, feel for the isthmus and the lobes, and I'll have you swallow for me, and we'll see if we can feel anything there, see if there's any swelling or anything going on there. I'm going to get behind you real quick. Give me just a moment. Okay, so you'll just feel me palpating gently around the lower part of your throat. Okay, very good. And while I'm feeling here, if you could just swallow for me. There we go, very good. Okay. So while I have you here, I am just going to auscultate the lobes of the thyroid. Don't normally have to do this, but I just want to check if there are any bruits. So I'm going to pop in my stethoscope and I will be listening one at a time, okay? So I'm going to put my stethoscope on one side of the throat. I'll have you take a deep breath in and hold it while I listen to the blood flow. Okay? So if you could take a deep breath in for me and hold. And relax. Good. Other side. Take a deep breath in for me and hold. And relax. Good. Okay. No brewies for you. Brewy is an audible heart murmur. I'm not sure what a brewy is, but it sounds just as unpleasant as a brewy. Okay, so it looks like we are all good. Done everything that we needed to do. Okay. All right. So, you have any questions at all? Nope, I didn't find absolutely anything out of the ordinary. You're not seeming to suffer from any allergies. You don't have anything that suggests that we need to look further into anything. Okay? All right, let me go ahead and just sign off. Very good. And we'll put that away. Excellent. So is there anything else I can do for you? No? All right. Thank you so much for coming in today and having this HENT examination. I really appreciate it. I hope you have a whale of a day and a good rest of your night. Thank you. Bye now.
Thank you so much for watching this video. I really appreciate it. I create primarily medical, alternative medicine / pseudoscience and personal attention ASMR roleplays. If you want to check out a specific category of my videos, my channel playlists have everything from sci-fi to historical to even fantasy videos. If you want to support my work, consider checking out my Patreon profile in the description box, where I offer early access to videos, exclusive content,